Namaste, everyone. Welcome to this case study presentation. Today's case is yoga for PCOS or polycystic ovarian syndrome. So we all know that the female reproductive system is much more complex and complicated than the male reproductive system because in addition to the formation of the gamete, the female reproductive system also has to nurture the developing fetus, and it is also involved in the suckling of the infant at a later stage. So, because of this complexity, the female reproductive system is more prone than the male to different disorders. And some of the disorders that we have heard of or we are familiar with are the menstrual disorders, amenorrhea, dysmenorrhea, menorrhagia, and we know the PCOS is polycystic ovarian syndrome. We have polycystic ovarian disease or PCOD. We have endometriosis, and then, of course, female infertility, uterine fibroids, then sexually transmitted diseases, pelvic inflammatory disease, prolapsed uterus, and even different kinds of cancers afflict the reproductive system, like the breast cancer, cervical cancer, ovarian cancer, and other gynecological cancers. So I also have mentioned menopause here because menopause, though it is not a disorder, some of the symptoms of menopause or some of the conditions in menopause can cause great distress to the woman. So so let's have a look at the female reproductive system. And though we touched upon this during our DYT classes, I just wanted to brush this up quickly. And what is presented here, the picture that is presented here is that of the ovary. And we know that there are a couple of ovaries present in females, and each ovary releases one egg every month. So along with the eggs, the female hormones, that is estrogen and progesterone, are also produced by the ovaries. And these are the hormones which regulate the menstrual cycle, fertility, and facial hair, and many other changes in the woman's body. And along with these female hormones, a very small amount of male hormones are also produced by the ovaries, and these are called the androgens. So these androgens are also produced in the male reproductive system in larger quantities, but here in small quantities in the female reproductive system. And the ovarian cortex is composed of tiny masses of cells known as the follicles or the ovarian or the primordial follicles. And what are follicles? They are small sac-like structures, and they contain the immature egg. When a female child is born, then she has hundreds of these immature eggs, and each of these eggs is surrounded by one or more layers of the follicle cells. And as the developing egg begins to ripen or mature, then that is during puberty, when the developing egg begins to ripen or mature, the follicle enlarges and develops a fluid-filled central region. And when the egg is totally mature, then it is called a Graafian follicle, and it is ready to be ejected from the ovary and in the process of ovulation. This process is known as ovulation. So what you can see here are the early primary follicle in purple, and then that's developing and into the late primary follicle, secondary follicle, and finally it gives rise to the mature follicle or the Graafian follicle, and that gets ejected out of the ovary. This is the normal ovulation process. So let's see what happens in polycystic ovarian disease or PCOD. And this is again what is presented. The picture here shows multiple immature or partially mature egg follicles, which are eventually they turn into cysts. So unlike in the other picture where you saw the egg is ripening, it is maturing, and then the woman is ovulating, here you have all these follicles which are not developing into are not going through the complete life cycle. They're not forming the mature follicle. Instead, they remain as is, and eventually they form a cyst. A cyst is nothing but a liquid, fluid-filled sac. Okay, a liquid, fluid-filled sac. And Then what happens when a large number of such cysts are present in the ovaries enlarge and they produce the male hormones or the androgens. And this affects the woman's life and fertility. So, what are the causes of PCOD? Our own genetic tendency towards this disease. There is the genes, and then adding to that, the triggers are unhealthy diet, obesity, stress, and hormonal disturbances. The symptoms of PCOD are the woman could have delayed or irregular periods, and when the periods are there, then there's heavy bleeding. There could be abdominal weight gain, infertility, and male pattern hair loss. And it is usually detected when a lady is not able to conceive for a long time despite trying. And then they go for a checkup and they find out that there are a large number of these ovarian cysts, and they find out the cause, and then they do a number of tests and they find out that she has PCOD. So that's how it's detected. Polycystic ovarian syndrome, PCOS, is a little different from PCOD, though many people confuse one with the other and they use it interchangeably. It's a little different. This is a much graver and much more complicated and complex metabolic and reproductive disorder. And here what happens is a large amount of the androgens are produced by the ovaries. So these androgens, they hamper the ovulation process. They do not allow the primary follicle to mature into the Graafian follicle or the mature follicle, and they hamper this entire process. And instead, then what happens to the primary follicles? They go ahead and they form these ovarian cysts, like we saw earlier. And cysts are nothing but liquid-filled sacs. So large amount of liquid-filled sacs are now there in the ovary, and they go on accumulating. And instead of getting discharged, these cysts just remain there. And you can see in the picture what's happening. On the left, you have the normal ovary, and on the right side, you have the ovarian cysts, so this ovary with the large number of cysts. So cysts are often large, and they are made up of non-developed eggs and various other ovarian secretions as well. So the secretion of the androgen and then the presence of these cysts induces the ovary to produce a large amount of androgen. And these androgens, when these androgens, the quantity of these androgens is greater than the production of the female hormone, that is estrogen, then it gives rise to a lot of abnormalities in the overall body of the female. So about 25% of so-called normal women do have cysts, but not all of them have PCOS, right? So it's important to detect the increased androgen levels as well when the diagnosis of PCOS is not just looking at the cyst-filled ovary, but also we want to look at what the levels of the androgens or the male hormones are in the woman's body. So what are the causes of PCOS? One is there's a genetic tendency towards this disease. So genetic makeup is there, but it is triggered by insulin resistance and inflammation, also triggered by obesity, and then also stress-based adrenal PCOS. So what does that mean? When the girl or the woman is exercising a lot, indulging in a high-intensity exercise, then a lot of adrenaline is produced in the system. So this is stress-based adrenal PCOS, or it could also be psychological stress. And we know that when there is psychological stress, there's also an increased level of hormones or adrenal hormone in the adrenaline in the system. So the reasons are, or the causes are, we have insulin resistance and inflammation, we have obesity, we have stress-based adrenal PCOS, or it could also be due to a post-pill PCOS. And this is interesting. So when the woman is put on a pill, right? A woman is put on a pill or a birth control pill, and then she gets off the pill and then she tries to get pregnant, she finds out that she cannot conceive. And somehow during this process of taking the pill, the connection between the brain and the ovary is cut off and they are not communicating with each other. So even after the woman goes off the pill and is trying to conceive, she has developed this PCOS and she's not able to ovulate. And the other reason other reason could be is the other reason for PCOS could be a possible thyroid condition. And many people who have PCOS do have insulin resistance, and they also possibly have the thyroid issue as well. The symptoms of PCOS are the periods could be either the woman could be having difficulty in having her periods, or the periods could be regular, irregular, or it could be delayed, or they could be non-reliable. Sometimes they come, sometimes there are no periods. And whenever these periods are there, they could be intensely painful. And she could also have pain in the pelvic area. So along with this, there is also the hair loss, and then a lot of cystic acne, and then oily skin, and increases in facial or uh, body hair growth. And then there could also be patches of thickened dark brown or black skin, especially in areas of high contact, like at the neck or under the arms or in the groin area. So these are the areas where there could be darkened skin. And there could be excessive body odor. She could be experiencing sleep disorders, mood swings, anxiety or depression, and also insulin resistance or diabetes. So the person may not experience or may not have all these symptoms, but they may have a few of these symptoms. PCOS is usually detected at an early age. When the girl starts menstruating, that's when these irregularities are noticed, and and this can be diagnosed at an early age. And this causes infertility by affecting the release of the ovarian egg in the menstrual cycle because of the high levels of androgen in the system. And so far, according to medical science, there is no cure, but there is the hormone production can be controlled, and the skin also can be cleared up with hormone therapy. So the diagnosis of PCOS, a skilled gynecologist could do a pelvic exam to determine what is happening, or even ultrasounds can be carried out to check for the cysts. And lab work can be done to detect the blood glucose levels, high blood glucose levels, and also detect the male hormones, that is the androgens. So also high levels of male hormones, other than that, the disproportionate ratios of the luteinizing hormone to the follicle stimulating hormone, LH is to FH. So that also indicates that the person might have this syndrome. So I just listed out some of the differences between PCOD and PCOS. There are 6 differences or 6 points in how they differ. One is the seriousness of the condition. PCOD is less serious, and it can be possibly treated with exercise and a diet regimen. Losing weight, eating right, eating healthy, exercising, losing that excess body weight could regulate and could normalize, and a person can conceive even though they have PCOD. PCOS is a graver condition and it's harder to treat. And when it comes to prevalence, PCOD is more prevalent, PCOS is less prevalent. About 5 to 20% of women have PCOS. And when it comes to complications, PCOD is less complicated. PCOS has more complications. And the females are prone to developing cardiovascular issues, or hypertension, diabetes, obesity, or even endometrial cancer. So when is this detected? Visibility. Visibility means when is this detected? So PCOD is detected, as I mentioned before, when the woman is trying to conceive, and PCOS, the symptoms become visible during the teenage years. And when it comes to fertility, the women with PCOD do not show considerable fertility complications, and they respond to fertility treatments fairly well and also to lifestyle changes. Whereas women with PCOS may deal with infertility, and even when they do get pregnant, they could have miscarriages, and this could happen even after the lifestyle changes are brought into effect. So when it comes to ovulation, PCOD women with PCOD ovulate normally over regular periods and they can be pregnant without any problem. However, those with PCOS cannot ovulate because of the disturbed hormonal secretion. So this slide shows the connection between high insulin and androgens and what's happening in the body. So the insulin is what is known as the storage hormone. So when we consume food, there is a mechanism in the body to detect a rise in the blood sugar. And when the blood sugar is high for a long time, the body does not want this sugar to be floating around, right, in the bloodstream, because it can lead to damage in the cells of the brain, liver, pancreas, heart, and eyes. So some of these things we have seen in people with diabetes, right? High blood sugar can damage cells in the brain. And these days they also say that mm, type 2 diabetes, if you have, or diabetes, affects the brain in such a way, and they have found a link between type 2 diabetes and Alzheimer's, right? So that's how it affects the brain. And then it can affect the eyes. We all know that. And so the body, what does it do? It does not want this sugar to be floating around. And the sugar has to be stored somewhere and it is stored. The insulin is storing the sugar in the liver cells for later use. So whenever there is a need, the glucose is taken out of the liver cells to be used at a later point in time. So insulin is the hormone that tells the cells to open up and let the glucose in. And this is secreted by the pancreas, and this binds to a receptor on the cell wall. So just like Dr. Nagratna always gives the example of the king and the minister and a gatekeeper and so on, what is insulin doing? It's playing the role of the minister, and the king is of course glucose, and then it brings glucose to the cell, and that is the one that opens the key or opens the gate. Unfortunately, when this key has been used too much, or when there is chronic low-grade inflammation, the lock or the receptor starts to fail, it starts to get worn out, it gets clogged up, and the key no longer fits. And this is known as insulin resistance. So there is glucose, there is insulin, except that the cells have developed a resistance towards the insulin. So high levels of insulin stimulate the ovaries to produce more and more and more androgens. The presence of high levels of insulin makes the ovaries produce more androgens. So physiologically, what is happening during puberty? The girl is already gaining a little bit of weight, right? Physiologically, that's what's happening. It's natural for the girl to gain a little bit of weight, and added to that, she could be undergoing stress. She could have obesity, and also the genetic tendency for this PCOS. So add all that together, and there is more insulin in circulation, and then what is the result? It's PCOS. So PCOS, this predisposed ovary responds to obesity with overproduction of androgens, and this leads to more obesity, and this perpetuates the vicious cycle, and that's shown in the red arrows in this picture. So this is a multifactorial disease. There are a number of factors which cause PCOS. We have stress, of course, whatever thoughts, feelings, and emotions that we are undergoing, they could induce the production of stress hormones in the system. And when the stress hormones are chronically elevated in the system, then it could lead to long-term hormonal imbalances. And then we have irregular sleep also contributing to hormonal imbalances. We have environmental pollutants like, for example, BPA, plastic, and other things that end up in our food or in what we breathe. When it ends up in our system, it could also lead to hormonal imbalances. And then we have the obesity as being an important reason. We know that obesity causes insulin resistance and inflammation, and these cause hormonal imbalances, and these hormonal imbalances in turn, it perpetuates the obesity, and the cycle continues. And obesity also increases the levels of testosterone in the body. So as you see, it's a complex disease. There are a whole bunch of hormones that are involved, and um, and even a slight imbalance can throw the whole process of ovulation out of sync, and this leads to fertility issues. So yoga is very useful for female reproductive disorders, and not only for PCOS or PCOD, but also the other conditions as well. And yoga practices are, as we all know, very, very useful with weight management. Gives a gentle workout to your entire body, all the practices that we do, right from the breathing, breath and body synchronization practices, the loosening practices, the asanas, all help with weight management. And importantly, it increases the blood flow to the pelvic area and then the brain. That's where the master switches are, the hypothalamus and the pituitary, right? So increased blood flow to the brain where the command center is located, and then also to the reproductive organs and all the other endocrine glands. And also it helps to stimulate the downward energy from the navel to the floor of the pelvis and increase in the microcirculation in the reproductive tract. It opens up the pelvic area, it improves blood circulation, and there is stretching and compressing of the abdominal and pelvic organs, which of course is invaluable in alleviating any disease of any part of your body, the alternate stretch and compress aspect of yoga. And there are several dynamic practices that are given which stimulate the internal organs, especially the pelvic organs, and which help in weight reduction and which improve pelvic circulation. And then we have Surya Namaskars, which when given at a fast pace can be excellent for weight loss. Good cardio workout there, improves the endocrine health, right? And every asana in the Surya Namaskar is benefiting the endocrine system, not only the endocrine system, all the systems. That's why it is a complete practice. It is a very wholesome practice. But endocrine system, especially, it's very useful. And if you see when you do Ardha Chakrasana, there's your thyroid and then your adrenals. When when you do a back bend, thyroid and adrenals are getting stimulated, and then you do the forward bend, the squeezing effect happening. So each asana has a stretch and compress effect to it in the Surya Namaskar. So, however, it's a good practice to do a few rounds initially, more for relaxation. You want to always keep that in mind, that relaxation is the most important thing for PCOS as well as PCOD. And in case of heavy bleeding or endometriosis, on days of heavy bleeding, or even if the woman has endometriosis, Surya Namaskar practices can be avoided in a dynamic manner. Maybe you could give gentle Surya Namaskars or modified Surya Namaskars. So different yoga poses help in slightly decompressing and compressing the specific glands, and these improve the circulation. And also it strengthens the body, it strengthens the core, and it also builds up the strength of the uterus. So if you look at our grandparents or even the generation before that, people used to do a lot of work around the house, and people were busy. They would squat, they would get up, they would work in the fields, they would work in their little gardens outside their homes. So a lot of physical work was done by the women, and this not only strengthened their core but also kept their uterus strong. Now, importantly, yoga also helps in correcting sleep disorders by giving a deep rest to the system. And sleep is very, very important for the lack of sleep. There has been research showing the connection between lack of sleep and obesity and insulin resistance and inflammation. So you want the person to sleep well. We want the part of the therapy has to be to teach them to sleep well.